Welcome to the April edition of the International Spotlight Program. I'm so happy to be joined by Dr. Lina Triana, who's the president of the Colombian Society of Plastic, Aesthetic, Maxillofacial, and Hand Surgery. Welcome, Dr. Triana.
Hi, Phaedra. It's an honor to be here with you, and it's an honor to be part of the Aesthetic Surgery Journal.
And we feel the same way. So we are here today to talk about the increase in female genital surgery. And the American Society for Aesthetic Plastic Surgery just recently released its new statistics report, and they indicate that the labiaplasty, not vaginal rejuvenation, but specifically labiaplasty, was the 19th most performed surgical procedure last year, with 10,774 performed. So there's an increase in these type of procedures, so much so that the journal launched a new section called Genital Rejuvenation last year to accommodate all the new research. So we'd like to hear from you with your international perspective about what you're seeing in terms of trends and how you manage that in your practice.
Well, definitely, it's a trend that keeps on increasing and increasing every year. Also, if we see at the ASAP statistics, it increased 23% from the last statistics you had. So it's going on and on.
Absolutely.
So definitely, it's something that it's not only in the US, it's happening all over the world. Why? Well, maybe because today we women are more empowered, not only of our own life, not only in our, for example, in our working life, in our working atmospheres, but also we are empowered with our sexuality. And that gives us one thing more that we really want to improve. Of course, if we see the trend, for example, in South America, is a big thing now. Why? I think Latin women are a little bit more open to talk about these areas. And as traditionally has been seen, aesthetic plastic surgery in South America is something that is more of a common. Everybody wants it. Everybody do it. We have a tropical climate all year round that helps that our women show a little bit more regarding how they dress. And they are not afraid or a little bit ashamed of talking about themselves and of talking about these type of procedures.
So, Dr. Triana, how do you think this is culturally in terms of what you're seeing in Colombia? You talked about the climate and some of those details. Here in the United States, you travel a lot. What are you seeing in other countries? Do you see the trend as the same? Is there excitement, enthusiasm about these procedures? What do you see when you travel and when you network at conferences with colleagues?
Well, definitely, as you know, I've been lecturing in vaginal rejuvenation a long time ago, many years ago, and I really am very excited from what I see, not only towards patient trends, but from what I see from my colleagues. Before, if we talk about 2008, 2009, when I lectured about vaginal rejuvenation, labiaplasty, vaginoplasty, it was almost like a taboo. And a lot of the doctors, my colleagues, plastic surgeons, would usually say, "Oh, that's not worth it." Sometimes they would get in the meeting, and sometimes they just thought it was okay. That's not worth it. But today, when you go to a meeting, the auditorium is full. So you really see that plastic surgeons want to learn more and more and more about it. And actually, that's what you guys did in the Aesthetic Surgery Journal. You today we now have a whole section here. So because really there's a true and sincere, let's say, wanting from all of our colleagues to learn more about aesthetic vaginal plastic surgery. And of course, also it's very nice and very, how do you say, retrieving to see that in our meetings, even in the big meetings, we have sections that are only for vaginal plastic surgery. So again, it's not only a patient's trend. It's something that our colleagues have started to understand, that it's something that we should offer to our patients, not only because it's a trend, but because it really helps my patient. Sometimes if we saw past texts or old textbooks, or again, meetings regarding vaginal plastic surgery, you could see only sections talking about labiaplasty. Mm-hmm. What is labiaplasty? Labiaplasty mainly is cutting the labia minora, and that's it. And I always try to encourage all of my colleagues that if you approach this surgery only by cutting the labia minora, That's a total incorrect approach. Why? You need to talk about the whole genital area to really deliver a good surgical plan and to really have happy patients. We all know that, for example, when we talk about labia minora, they are sometimes very long and they bother my patients. When they're doing exercise, they're uncomfortable, they don't look nice, and also when there's excess amount of mucosa or skin around the clitoris hood, it can look like a penis, not nice. It can how do you say, help with bad odor there because it's more difficult to clean the area. And other areas such as the pubic area or the perineal area are not nice also and can be helped. And of course, the labia majora, that with time everything loosens, and the genital area is not an exception. And as we go more and more, grow more and more in time, we lose tissue there, so they look shaggy and savvy, and we don't like the appearance. So all of that can be constructed when we talk about external vaginal plastic surgery or genital aesthetic plastic surgery. So now I tell my colleagues, if you only take one thing back home when I'm lecturing them, I always tell them, please forget about only labiaplasty. You have to look at the whole picture to have a happy patient. And of course, now vaginal rejuvenation, that is the vagina tightening, is getting more and more on trend because, as I told you at the beginning, today we are empowered with our sexuality. We want to lead not only in the aspects of family as we did as leaders of our home, we're also leaders in our work, and now we are also leaders in our sexual life. So that's why more and more patients are asking for it, because women today are empowered with their whole life.
Thank you.
So I think it's very nice and pleasant to see we plastic surgeons can deliver this to my patients and can see how they really are happy, not only for themselves, but for their couple life as a couple, and of course in all of her aspects of her life. So really, I do encourage for any plastic surgeons that do not do now vagina plastic surgery procedures, vagina rejuvenation procedures, or the genital aesthetic plastic surgery procedures to start doing it. It's a must today. And of course, we all know that it's not only the surgical part, there's also a trend on all the non-surgical areas of the vaginal rejuvenation. Mm-hmm. There are lots of machines today that we can use for vagina tightening. Of course, I always tell my colleagues when I lecture, if we're thinking, for example, on a patient that had a baby, and she has a savvy, shaggy, whatever how to say, the abdomen area, mm-hmm. and we need her, or she wants a tight abdomen, then I cannot tell her just go ahead and do some push-ups or go ahead and do this treatment with this machine and you will have your abdomen exactly the same as you had it before.
Sure.
That's not nice to tell to the patient because she will get frustrated. We all know that there's a lot of loose skin and a lot of loose muscle. We need a surgery to be done down there. So again, this new trend on non-surgical machines or treatments for vaginal plastic surgery or genital aesthetic surgery, they're very good. I use them all. I use radiofrequency, I use lasers, I use fillers, because again, the final results, it's like a sum up of a lot of things. But we need to understand that for some patients, we need a surgical approach, and for others, we need only a non-surgical, and from some others, we will need a lot of them.
Now, what about the psychological impact of this kind of surgery? We've published several articles by Gemma Sharp and colleagues in the Aesthetic Surgery Journal. I'm sure you've seen some of them. Could you talk to us a little bit about that impact on patients when they have this kind of surgery?
Definitely. That's what I see in all of my patients, their own history and what happens in their life. And it's very nice, the impact, as you said, that it had, because some patients simply are ashamed of showing their external genitalia to the point that some patients can't even stay with a partner which they are not fulfilled, only to have exposed to a new partner. And when they have this surgery, it's just change of life. Now they're free. Now they can go on and don't be ashamed of it. And again, and have sexual gratification, because really that we should not be ashamed of telling that. That's why sexual intercourse is there, right? Not only for having babies, right, but also for letting us be more secure about ourselves in all of our aspects of life. Again, around our social area, our working area, and again, as a couple. So this is one thing. And again, also after having a baby, we all know that the baby is there for 9 months. Even if you have a C-section, the baby is there in your tummy for 9 months, meaning that baby is heavy on your muscles, the muscles that support the vagina. So even if the baby is delivered, still those muscles are going to be more relaxed when the baby when the pregnancy finishes. So that's why many women after having babies, they don't feel their same sexual gratification as they had before having the baby. That doesn't mean that every woman has to have a gender rejuvenation procedure. That's not correct. Because that would be the same as comparing every woman that has a baby needs a tummy tuck, and that's not right, right? But again, if you had a baby and you feel you cannot contract the same during your sexual intercourse, and you discuss it sometimes with your couple, and it's the sense of a couple that you don't feel good, why don't do the surgery if today you have it easily accessibility to do it? So again, as storytelling what my patients tell, usually the couple comes to the office concerned about it, and then they're both happy. So again, I have a lot of stories of the external part, genital aesthetic plastic surgery of the internal part, and we really see that little changes make big differences.
Well, we so appreciate and value your input and also your support, the society's support of the journal. Thank you so much for spending time with us today.
No, thank you again for really, really being up to date always and giving good scientific material to us plastic surgeons.
We appreciate that. Thank you.